Very good evening, all of you. Can anybody please confirm if I'm audible and visible, if my screen and everything is fine? So I hope I'm properly audible and visible. Hannah? So welcome again to this another video or live session on Meded clinics. So as usual, so we are going to discuss about some of the interesting dermatology cases, like how you can approach to hair disorders today. Yeah, that is the topic for the day. And I guess this is a very interesting topic. The reason is, I guess there is nobody who is not having a problem with the hair, isn't it? Everybody will have some kind of a problem or the other. If somebody is having a problem of increased hair fall, the other person would be having a problem with increased, dandruff and all those issues, or one or the other. Correct? So what we will do is, in today's session, what I'm planning to do with this Meded clinics is today we will learn about some of the common hair disorders that you are expected to see in the dermatology OPD. Okay, so in this common hair disorders that you can see in the dermatology OPD, so we'll first try to understand what is our learning objectives today. Like, for whom is this video, or who is going to be most benefited out of these kind of videos is for the first time when you're having a posting in the dermatology department, and when you get to see a lot of new cases, definitely the people who are having these kind of issues end up in the dermatology OPD, and they may come to you with a lot of common complaints of the hair. And it is very important for you as a very good physician to have an understanding like what should be your approach when you deal with these kind of cases. What are the differential diagnoses that you should keep in mind? How can you narrow down the new differential diagnosis based on the presentation? And finally, reach a proper management. So that is the basic idea of learning about the common hair disorders. So what we will try to learn today is what are the common hair complaints in the OPD. So this is the topic that we are going to discuss today. Now, what do you think? Like, which kind of patients can actually end up in the OPD with a complaint that I'm facing this problem of my hair? So what do you think are the common complaints? Can anybody let me know in the chat box? What are the common complaints that you expect? I'm not asking about the name of any big diseases and all. So there is not such a question here. I'm just asking you, what are the common complaints or the symptoms that the patient may complain to you when they come to you to your OPD with a hair problem? So I'll just note it down one after the other. So I'll just give this as the first point now. First and the foremost common problem is I'm having a lot of hair fall, isn't it? So one of the common complaint is going to be increased hair shedding. So this is going to be one of the very common problems that you will encounter in a dermatology OPD, increased hair shedding. So we will discuss about what are the common causes of all those hair shedding, etc. And now what is the other one? What do you think if somebody is of an age of around 30 to 35 years of age, and if they come to you saying that I'm having a lot of white hairs now? So premature graying of the hair, will a patient come to your OPD or not, or will they just leave it as it is? Most of the times this hair has a lot of importance when it comes to your cosmetological appearance and a lot of things, right? So they will definitely come to you. So another complaint can be premature graying of the hair. Anything else? How a patient can come to you? How about a thinning of the hair? Okay, like what do I mean by thinning of the hair? Like some of you, like it is not necessary that we have patients, but hair disorders we can see everywhere, even in our closed groups, isn't it? So anywhere it is very common to be seen. Now the another very common complaint is thinning of the hairs. So what do I mean by thinning of the hairs? The patient can come to you and the patient can tell you that my scalp is so visible now. Earlier I used to have very thick hairs, but right now my scalp is very much visible. So that is going to be a complaint of thinning of the hairs. That is another very common one. Anything else? Other than this common kind of hair fall, thinning of the hair, premature graying and all, sometimes the symptom can be very disturbing. and that can be because of some diseases. That is where you may get some symptoms like patchy hair loss. So there would be a small circumscribed area anywhere in the scalp or in the beard and mustache area where there is a patchy hair loss. So at that time, the diagnosis I will again become difficult. And sometimes a patient can also complain to you that I'm having a lot of itching of my scalp, and I can see that my entire um, shirt is having a lot of whitish dusty kind of a material, isn't it? Now what is that? The thing which we commonly call as dandruff and all. So in such cases they may complain to you with complaints of itching or scaling of the scalp. That is going to be another complaint, isn't it? So itching or scaling of the scalp. And sometimes when it comes to certain infections or when it comes to some um, hair shaft disorders and all, the patient can also complain that there is some fragile or brittle hairs. For example, if I just fold my hair right now, it is not breaking. But sometimes the patient can also come to you with complaints of fragile or brittle hairs. So when I just try to remember what are the common complaints with which a patient can come to you to the OPD for a hair disorder. So these are the symptoms that comes to my mind. Increased hair loss, premature graying of the hair, thinning of the hairs, patchy hair loss, itching of the scalp and scaling of the scalp, and fragile or brittle hairs. So what happens when you see all these kind of symptoms is that now we have to differentiate why is a patient is having these kind of a symptom and what are the diseases that can be associated with it, correct? So now let us see one by one. So what we'll try to do here is we'll go on a system based approach, because when you learn your textbooks, the textbooks are not going to tell you a system based approach. That is where Med Clinics is going to make the difference, because here what are we trying to do is we are trying to analyze a patient based on their symptoms, and then we are going to teach you what should be your approach and how you can narrow down your differential diagnosis and ultimately end up treating the patient properly. Okay, so now let's begin with the first and the foremost symptom. The first symptom which I have written in the initial page was regarding increased hair shedding. So what happens with increased hair shedding? A patient can complain. So I'll just write down the complaint here. The patient will complain of increased hair fall. Okay, the patient will complain of increased hair fall. By the way, if you should understand what do you mean by an increased hair fall, you should also understand what is a normal hair fall in a day. What do you think? In normal individuals like me and you, isn't it not possible to have a hair fall every day? Definitely there is a hair fall every day. So first remember this thing, that the normal hair fall in a day, any guess how much is it going to be? Is it 10, 50, 75, 100, 200, 250? How many hair fall in a day is going to be considered to be normal? So that's a question. So here the right answer should be 50 to 70. So not, let us say 50 to 100. 50 to 100 per day is going to be a normal hair fall. Only when a patient is going to have more than 100 hair fall a day, only then we'll have to evaluate the patient. We'll have to see if there is any underlying causes, and then we have to plan for a treatment. Otherwise, all that is required is just a good reassurance. Clear? So now let's see what is happening here. Now you can see that there are two images. The first image is of a male and the second image is of a female. Now, there are two different patterns of hair loss here. Now, this is a patient who comes to you who complains of an increased hair fall, and what you can visibly see is that there is a patterned hair loss. So, what is this disease where we can see a patterned hair loss? Why do I say, yes, doctor, 50 to 100 strands a day is going to be normal? No. Sorry. So what do you mean by a patterned hair loss? Patterned hair loss means there is a specific pattern which you can see in males, and there is a specific pattern that you can see in females. So that is called as a patterned hair loss. Now what is happening here is, just see the first image. Hi Kalai, good evening. So just see this first image. Now can all of you see that there is a pattern like this? Okay, which alphabet in English does it resemble to? So there is a M-shaped pattern, isn't it? So the hair is receding backwards, and because of which there is a M-shaped pattern. So this is a male pattern hair loss. So this is a male pattern hair loss. So in males, we call this pattern as Hamilton pattern. So all these pattern hair loss, what is the actual name of the disease that I'm talking about? Can anybody tell me? Yes, absolutely right. In males, there is a, yeah, the frontal part, there is a recession, isn't it? So, hi Anisul Nabi. So what is this? So what is the name of the disease that I'm talking about? When you get a patient who complains that I'm having an excessive hair loss and I can see that my frontal hair is receding backwards in a male. So here, which kind of alopecia, Praveen? Can you just make it little more closer to the diagnosis? Alopecia means loss of hair. Now, can we make it little more closer? Excellent. Curiosity is answering. This is androgenic alopecia. Anisul Nabi is answering male pattern baldness. Kala is answering androgenic alopecia, non-cicatricial alopecia. All of you are right. So this one is called as androgenic alopecia. So don't worry, what is going to happen is when you do your medicine, like day by day, what is happening? We are going to lose more and more hair. So by the time you graduate or you complete all these things, what happens? A lot of hair is going to be lost, but we can't help it. But of course, there are 3 treatment modalities that is available. Okay? Now, what about females? In females, is their anterior hairline going to be stable, or is it going to be fixed, or is it in females also, are they going to have a recession of the anterior hairline? What do you think? Anybody in the chat box? So in females, kya ho raha hai? Is it going to be fixed or is it going to recede backwards? So remember, in females, the anterior hairline is going to be fixed. That is why we don't see any M-shaped pattern. Correct? So what happens in the case of female is, you can see in this image, so the female is complaining that there is an entire hair loss from this part of my hair, isn't it? So that is happening in a female. Yeah, so there is no recession in a female, but in females we have 2 different patterns. So I'll just write down the name of the patterns now. So one is called as Ludwig pattern and the other one is called as Olsen pattern. So Ludwig and Olsen pattern. So the image that I've given you today, so in this image what you can see here is that there is a female who is having some hair loss, because of which her scalp is very much visible, and we can appreciate that there is a hair loss in this fashion here. Probably she is having a hairstyle in such a way that she is taking up hair divided from the center, correct? So which tree does this resemble to? So in your imagination, can you imagine that this is gonna resemble some kind of a tree? So in this pattern, is there any tree which can be considered to be resembling this pattern? So remember, Olsen pattern. So this one, Olsen pattern, is also called as Christmas tree pattern. So this is also called as Christmas tree pattern. Okay. So that is how it is being compared to. So Olsen is Christmas tree. So all these things are going to be a case of patterned alopecia or androgenic alopecia. So please remember, whenever you get a patient who is complaining, मुझे काफी ज़्यादा hair fall हो रहा है, and then when you examine the patient कि हाँ scalp भी visible है, and more than that, when you see a patterned alopecia, an M pattern in males, whereas a central part of hair loss in females, so this can be considered to be a patterned hair loss or androgenic alopecia. So इतना diagnosis तो clear है. So now let us see what are the other causes of increased hair loss in another patient. So now let us see one more thing. I'll just write down another clinical example. So the clinical example is that there is a complaint of increased hair loss, and this increased hair loss has happened during exams. So there is a student who is coming to you, and the student is saying that I was already having some hair loss, but my hair loss has become terrible, and I cannot see this again because I'm getting so much of hair loss that is happening. And recently I was going through an exam, and it was going through a 1 month or 1.5 months time. So whenever there is any stress that is associated, so let us say exams तो काफी stress होंगे, correct? So exams के time पे या फिर because of some infections, like a patient was getting treated for tuberculosis, and during the course of tuberculosis the patient is complaining ki I'm getting a lot of hair fall. So what is this associated with? I can give you more examples, but whatever examples I may give you, I just need one answer as a final diagnosis. Okay? So another example is a patient who had an injury or a trauma because of which he had to undergo a surgery. So after surgery, the patient is complaining कि काफी ज़्यादा hair fall हो रहा है. What is this? So everywhere. So another example is a patient is having a anemia. मतलब hemoglobin is less. So in anemic patients also they complain that I'm having a lot of hair fall. Another example I can give you is pregnancy. So my question to all of you is, what is the common factor in exams, in infections, in surgery, in pregnancy, in anemia? Is there anything common? So it's like a riddle. It sounds like a riddle, correct? So what is the common thing in all these? Make a guess. Give me some good answers. Hmm? So, yeah, very good. I'm getting the right answer here, but yeah, I'll just jump into the diagnosis in some time. But before that, yes. So, Kalai is saying that this is going to be associated with stress. So, anything that is associated with stress will definitely increase your hair fall because there is a condition which is called as telogen effluvium. So there is a condition called as telogen effluvium. So please remember, telogen effluvium is going to be the case whenever you get any of these conditions which is associated with stress. So when you as a physician in your OPD, when you listen to a patient who is having a lot of hair fall, you have to ask the patient like what is going on, whether they are stressed with some of their personal things, or they're stressed with because of some exams or some difficulties that whatever they may have, or it can be because of some underlying diseases, or they will tell you that this happened while I was undergoing a surgery and I was taking rest. I was taking some bed rest during the last 2-3 months, but I'm experiencing a lot of hair loss. In all those cases, please remember your right answer should be telogen effluvium. And very easy to tell you कि what should be the management of telogen effluvium. Just let me know कि telogen effluvium का management क्या होना चाहिए. Very simple. Just look into the reason behind telogen effluvium. So whatever is causing the stress, you manage it. जैसे if the patient is having exams, reassure the patient कि exams के बाद ठीक हो जाएगा, अपने आप ठीक हो जाएगा, no problem. Just reassure the patient. अगर infections है, please make sure that the patient is getting treated for the infection. If it is surgery, then after surgery, just say that in a couple of months you're going to be okay. Pregnancy, of course, after delivery, the patient is going to be okay. And finally, anemia, treat the underlying cause. So if the underlying cause is because of anemia, so give some iron supplements and the patient will recover well, and the patient will feel that the hair loss is also getting better. Clear? So that is all about the treatment when it comes to telogen effluvium. Now, after talking about this condition where we have increased hair loss, where there is a generalized hair loss, now let us also move into the next one where the patient can complain of a patchy hair loss. Abhi, patchy hair loss, what do you think? Is it a disturbing symptom for a patient? Now imagine that there is a male patient, a young male who is coming to you. He'll come to you very disturbed, saying that, see, I always keep my beard very much groomed in proper shape, but now I'm facing a problem that I can see that there is a small area, a round, well circumscribed area in my beard area where there is no hair growth. Okay, there is a loss of hair in that area. So this kind of hair loss is called as a patchy hair loss, where there is a well circumscribed area of hair loss. So this one is called as patchy hair loss. Now, even if you have attended the previous lectures and all, I'm sure that you'll be able to give me at least one differential diagnosis when a patient will come to you with a patchy hair loss. If you need one clue from me, I can give you one clue. This can be seen in an autoimmune disease. Can you make a guess? This can be seen in an autoimmune disease. So what is a disease where a patient can present to you with a patchy hair loss? I'm just asking you for one example now. So any answer? Just one example. Excellent. So I got the answer in the chat box. So this is called as alopecia areata. This is called as alopecia areata. So what is alopecia areata? It is an autoimmune disease where our body is attacking our own hair follicles, right? So in alopecia areata, so if you get a patient like this in your OPD, and you can see that there is a well circumscribed area of a patchy alopecia. Now I'm asking you that can we prescribe any injection to this patient? Well, today we'll take one shot. After 10 days, we'll take one more shot. We'll see how the patient is responding. So what is the treatment that I'm asking you? So what is the treatment? Can you name one injection which can be given in this patient which can take care of this case of alopecia areata? Yeah, curiosity is answering. It's a steroid injection. And I want you to be more specific. Can you just think more कि कौन सा steroid injection देना चाहिए? Because I'm asking about a intralesional steroid. Because I want you to hit this target directly into the patchy alopecia. Very good. The answer is in the chat box already. This is going to be triamcinolone. So we can go for triamcinolone in this patient. And also there are multiple other modalities. You can go for any topical steroids, you can go for oral steroids or any other immunosuppressive agents. But remember one key point here. Whenever you get a patient who is having a patchy alopecia, one of the differential diagnoses that will come to your mind is alopecia areata. How about learning few more differential diagnoses for a patchy hair loss? I think I have an image. So now let's imagine that there is a child who comes to your OPD and you can see on examination, you can see that there is again a patchy hair loss. Now, how many of you think that autoimmunity is very common in children? और अराउंड व्हाट एज ग्रुप इज ऑटोइम्यून डिजीजेस कैन बी सीन? जैसे अभी अभी हमने डिस्कस किया कि एलोपेशिया एरियाटा इज अ ऑटोइम्यून डिजीज. तो ऑटोइम्यून डिजीज लाइक यू मस्ट हैव लर्नड इन मेडिसिन, it is seen in female fertile 40s, right? So around 40 years of age is the common time period where you can actually see an autoimmune disease. So whenever you see that a child is coming to your OPD, now you are not keeping any autoimmune disease in your mind. Now, in a child, what should be the first thing that comes to you when you see a patchy hair loss? Yeah, autoimmune, more in females. I completely agree with you. Now, can you answer this one? Whenever you see a child who is coming to you with a patchy hair loss, so यहाँ पे एक circumscribed hair loss है. This is called as patchy hair loss. So in this patchy hair loss, if it is a child, what should be your differential diagnosis? Excellent. So your differential diagnosis here should be Tenia Capitus. So this should be Tenia Capitus. Excellent. So if this is going to be Tenia Capitus, then what you should do here is, how can you make a diagnosis? Now you understood कि ये एक fungal infection हो सकता है. So this can be Tenia Capitus. When you go into your textbooks, you can see that Tenia Capitis is again multiple types. Kerion, favors, gray patch, black dot. All these are different types of Tenia Capitis. Now, can you tell me any investigation in this patient which can be done, which will help you to confirm कि हाँ ये एक fungal infection है? Excellent. The correct answer is here. It is going to be KOH mount. So this KOH mount would be positive, and once this is going to be positive, you can treat the patient with what do you treat it with? So is there any drug of choice in the case of Tenia Capitus? So what should be the drug of choice? Are you going to treat this patient with fluconazole? Are you going to treat this patient with amphotericin B? Are you going to treat the patient with griseofulvin, itraconazole, terbinafine? Very good. So here the drug of choice should be griseofulvin, and terbinafine can also be used. The terbinafine can also be used. So that should be your management when it comes to a child who comes to you with a patchy alopecia. Okay. So what is the thing that I'm trying to convey to you here is, if you see a patient in his middle age, around 40 years of age, think about autoimmunity. Alopecia areata ho sakta hai. If you see a child, then think about infections first. Tenia capitis ho sakta hai. Now I'll give you one more example here. Now this is another patient who is coming to you with the same complaint. अभी यहाँ पे भी complaint क्या है? The complaint here is again going to be patchy. The complaint is going to be patchy hair loss in a young female. So this is a clue for you. Now you're getting a young female who is having a patchy alopecia, or especially on the sides, okay, not over the frontal part. So she is having some hair loss over both the sides of the scalp. Now when the patient is talking to you, you see a very peculiar thing, that she is having a habit of just curling this hair and trying to pull it by herself. So now because of this reason, what should be the diagnosis? Now in this patient, you are seeing this kind of a feature, that she is simply rolling this hair and then just trying to pull the hair by herself. Now what is this? Very good. The right answer here. So this can be trichotillomania. So what is happening in trichotillomania? This is actually a psychiatric illness. So this is going to be a psychiatric illness. So we will have to refer this patient to a psychiatrist, isn't it? Now here what is happening is, there is a desire to pull the hair, okay, and the patient is unable to give it up. Okay, this is a impulse control disorder. This is an impulse control disorder where the patient is unable to control that impulse of pulling the hair, and because of which the patient will end up getting a patchy alopecia. And in this patchy alopecia, if you just closely examine, you can see some perifollicular hemorrhages as well. Why? Because there is a traumatic pulling of the hair. Okay, there is a traumatic pulling of the hair. So that is going to be a type of diagnosis which is called as trichotillomania. It is called as trichotillomania. Clear? So now let's move to another type. So far what we have seen is, we are just visualizing, or we're just trying to imagine different kinds of patients that is coming to you. First, when we started the session, we got a patient who is probably your age, let us say 20 years of age, 25 years of age, and is saying that lot of hair loss and there is a patterned alopecia. वो हो गया androgenic alopecia. And then we also discussed that other than patterned alopecia, when the patient is having lot of hair fall because of stress, something associated with stress, that is going to be telogen effluvium. Then we discussed that the patient is having patchy alopecia. So patchy, I gave you three differential diagnoses. One is Tenia capitis, one is alopecia areata, the third one was trichotillomania. All these are the most common ones that I'm telling you, because the list may be extensive, but just try to understand the most common disorders that comes to the OPD. So that is why I'm keeping it very simple. Okay? Now let's move to another one, which is called as scarring alopecia. ये जो scarring alopecia है, ये काफी disturbing है. क्यों disturbing? क्योंकि whenever you have having a area of an alopecia, Usually what happens when you give a treatment, the patient is going to recover and there is a hair growth again. But what happens with the scarring alopecia is that there is no hair growth happening again. So this one is also called as cicatricial alopecia. So this one is called as cicatricial alopecia. Now, this is one disease that you must have learned in your theory many times, and it's very, very important. Now, when you see this one, so when I see this image, so this, for me, this image is a spot diagnosis, or any patient comes to me in this kind of a clinical picture, it's a spot diagnosis. You just need to ask more questions, do some blood investigations, and you can reach out to the right diagnosis. Now, what is happening here is that there is a small area of alopecia. There are two different areas of alopecia, and in both the areas, I'll just zoom this image for you. I want all of you to see the findings here. Okay, so what is the first finding that you can see here is there is a darker area here, isn't it? There is a darker area here, and within the darker area there is a very thin skin as well. So this in the center, this is called as atrophy. And what do you see just outside the atrophy is an area of hyperpigmentation. So hyperpigmentation and atrophy together. So what is the disease that I'm talking about? Excellent. I'm so happy to get this answer in the chat box. Well done, Kalai. So this is called as discoid lupus erythematosus. Okay, this is discoid lupus erythematosus. So what is happening in discoid lupus erythematosus? There are only skin symptoms, because all of you must have learned about SLE. So what is happening in SLE? In SLE, the patient may complain of photosensitivity, malar rash, aphthous ulcer, isn't it? So all those features will be there. But in discoid lupus erythematosus, you'll find only skin symptoms, and these skin symptoms are usually scarring. So there would be scarring lesions over the skin, there would be scarring lesions over the scalp as well. So that is why in scarring alopecia, one of a very, very important differential diagnosis is going to be discoid lupus erythematosus. Yes, carpet tax sign is also seen in discoid lupus erythematosus. Completely agree with you. Now I'll show you one more. Now here, once again, I'll just adding to whatever we have discussed already, but we are just going a little bit ahead. Okay, now what is happening here is, I'll just show you. What is happening here is, imagine that there is a child who is complaining of a patchy alopecia, and this one is also leading to a scarring alopecia. So what we will do here is, just listen to me carefully. Earlier when I told you that there is a child who comes to you with complaints of a patchy hair loss, what was the first differential diagnosis that comes to your mind? So your differential diagnosis here was Tenia Capitus, correct? So in this Tenia Capitus, what is the investigation that you have done? You have done a potassium hydroxide mount. Potassium hydroxide mount is going to be positive. So that then you confirm and you're going to give a treatment with griseofulvin or terbinafine. Everything I agree. But in case if the child ends up in multiple patchy alopecia like this, so in this case, this is going to be Tenia Capitus itself, but the name of the type of Tenia Capitus which can lead to a scarring alopecia. Can anybody answer? Yeah, very good. So this is inflammatory. So this is going to be inflammatory type of Tenia Capitus. So this is going to be inflammatory type of Tenia Capitus. And what are the two options that you have? One is called as Kirion. The other one is called as Favus. One is called as Kirion. The other one is called as Favus. footprints on, not on the sand, footprints on the snow. Okay, that is pseudo pelade of broke. Okay, that is different. So that is a very good thinking that you have. Okay, that is a good thing that you have asked, but that is different. Okay, that looks different. Now here, this one is inflammatory type of Tenia Capitus, which, and especially what is more common here is going to be chirion. So chirion can lead to a scarring alopecia. So today during this session, we learned about two cases where a patient can present to you with scarring alopecia. So the first one was discoid lupus erythematosus. The second one that we have discussed just now is going to be chirion type of Tenia Capitus. There are many more examples when you read your textbooks, like pseudopelade of Broke is one. Another example is folliculitis decalvans, and multiple more examples which where you can find even in lichen planus, isn't it? In lichen planopilaris, you can also see a scarring alopecia. So here, what I'm trying to do is I'm just trying to give you images and just trying to correlate with the type of alopecia based on the clinical presentation. So moving further, now let us see what is happening here. Now there is a patient who is coming to you who is complaining that I'm having a lot of itching of my scalp. So complaint is itching of the scalp. Along with this itching of the scalp, the patient is also complaining of scaling as well. So what is this? So what is a differential diagnosis that comes to your mind? Anyone? अब ये तो काफी common disease hai. We can't even call it as a disease because this is seen in a lot of people. And probably whoever is watching this video, they are also having the same problem. It's a very, very common thing where you get a yellowish, I'll give you some more clue, yellowish, greasy, flaking over the scalp and seborrheic sites. So does this ring a bell? So what is this? So this one, yes, this is going to be dandruff, or what we call as seborrheic dermatitis. So this is what we call as dandruff or seborrheic dermatitis, where a patient can present with yellowish greasy flaking over the scalp as well as the seborrheic sites. Okay, that is going to be one. Any other diseases where, what about other differential diagnosis? So imagine that you have got a patient who is having a lot of dandruff issues, but when you see that, you can see a lot of these kind of scaling in the scalp. Now, can you please tell me some more differential diagnosis in the same patient? Some more differential diagnosis? Yeah, Kalai, this is going to be hypersensitivity to Malassezia yeast. That is the reason why you develop this kind of a dandruff. I completely agree. Yeah, very good. One of the differential diagnoses here is scalp psoriasis. Excellent. So scalp psoriasis is one of the differential diagnoses. What about any contact dermatitis and all? So contact dermatitis can also be one of the differential diagnosis. Like there can be some allergic reaction to some hair products the patient must have used, isn't it? So that is also a possibility. So one very good differential diagnosis which I got here was about scalp psoriasis. Now let us see how do we differentiate a scalp psoriasis from the usual dandruff or seborrheic dermatitis. So let us see how do we differentiate scalp psoriasis versus seborrheic dermatitis. So any answers for this one? Now you have been given a patient, and in this patient I'm asking you, can we differentiate clinically whether this is scalp psoriasis or this is just a very severe type of seborrheic dermatitis or dandruff? So how can we differentiate? I'll just wait for your answers. So whatever is the thing, the thought process that you have, just try to share those thought process. We'll try to see whether you're thinking it in the right way or not. Okay. So what is it? So please remember, in the cases of psoriasis, do you remember what is the primary skin lesion in psoriasis? in psoriasis, you would be able to see erythematous plaque lesions. So if I just zoom this image for you, in this patient, my diagnosis would be more in favor of psoriasis than seborrheic dermatitis. The reason is, yeah, so the reason is that I can see that the lesion, it extends beyond the hair margin. Okay, so whenever the lesions, they extend beyond the hair margin, then what happens? This is more likely to be psoriasis, because you can see some plaque lesions also, and you can also see some silvery white scaling as well. So that could be typical scalp psoriasis. The second option, which I have already got the answer in the chat box, is after treatment with ketoconazole shampoo, dandruff fades. So this is what you have written in the chat box. Absolutely right, because this would be something which is non-responsive to anti-dandruff treatments. Okay, let us say that the patient has taken ketoconazole for a longer period of time. The patient has taken selenium sulfide for a long period of time. But the patient says that that is absolutely no improvement when I'm using antifungal agents. So all those things will go in favor of which one? It will go in favor of scalp psoriasis. Okay, very good thinking, very good thought process. So that is how you can diagnose scalp psoriasis in comparison with seborrheic dermatitis. In comparison with seborrheic dermatitis. Clear? Now, moving to the next one. Now, let us imagine that you have got a patient like this. I'll just zoom this image for all of you. I'll just zoom this image for you. Now, what about this condition? Now, what do you see? First of all, every time when you see a patient of dermatology, of any skin condition, what you have to do is just try to see the patient and try to observe the skin of the patient and just try to describe it as well. So if I am given a chance to describe this patient's skin, I can see that there is some erythema, isn't it? So there is some erythema over the scalp. So there is some erythematous lesion which is present within the scalp and is extending beyond the scalp as well, isn't it? So what is coming to your mind? Very good, Virender. So Virender is saying that he would like to suspect some allergic reaction. Excellent. So that is exactly how it is. So if you're getting a patient who is complaining that I'm getting a lot of irritation, itching, and some redness of my scalp. So here the complaint would be redness, itching, and discomfort of the scalp. So in this case, what should you be thinking about? Are you going to think about any infections like fungal infection? Are you going to think about any diseases like psoriasis, lichen planus, discoid lupus erythematosus, alopecia areata? Does any of these things come to your mind now? Absolutely no, right? Because all these diseases, what I've told you, everything has a different presentation. So if you see this kind of a presentation, then think about allergic contact dermatitis, because there are a lot of skin products or hair products that is available today. So when you get these kind of hair products that is available, like somebody can be using a hairspray, somebody must have used a hair dye or many other products which they have used. After using any product, if the patient is developing this kind of an allergic reaction, not only just limited to the scalp but also to the adjacent skin, then you have to think about allergic contact dermatitis, isn't it? Yeah. So it can be due to PPD, isn't it? Paraphenylene diamine. It can be due to hair dyes. So all those things are possible. Now, in case you are suspecting something like allergic contact dermatitis in this case, then can you tell me what is the investigation that you would like to do in this patient? So So in this patient, what is the investigation that you would like to do? Would you like to turn on a wood lamp and see the color of the fluorescence? Would you like to do a trichoscopy to examine microscopically how does the hair follicles look like? Would you like to go for a skin biopsy or something else? I have not given you the right answer. I was just asking you many other vague questions. So what is the investigation that you would like to do if you're suspecting an allergy, especially a contact dermatitis in a patient who is complaining to you with the erythematous scalp? Yes, so answers are here. Patch test. Who is answering? Kalei, Virendra, all of you are answering. Excellent. So you are going to do a patch test in this patient, because once you do a patch test, you are not doing a patch test over the scalp, right? So you are going to do a patch test over the upper back. So we will stick a patch to the upper back, and in this patch we will have multiple allergens, and we will ask the patient to come back to our OPD after 2 days. Okay. So once they come back to the OPD after 2 days, once we remove the patch, wherever the patient is having an allergy to some allergen, so in those areas you can see some reactions. So that is how we can confirm the diagnosis that this patient is allergic to PPD. This patient is allergic to some chemical, some other allergen that is usually seen, isn't it? So that is how it is. And in all cases of allergic contact dermatitis, how are you going to treat the patient? So how is the treatment going to be when it comes to a patient of allergic contact dermatitis? What is the first step that you would like to take? Take a very good history, okay? Take a very good history. Try to understand when did the patient start getting the symptom. Especially try to establish that thing of contact dermatitis, that you got this lesion after you were in contact with so and so substance. And then what you have to do is avoid the allergen. So you have to ask the patient to stop using hair dye, stop using this hair spray, stop using this hair gel, or whatever hair products that they have used. Okay. The second one is the patient is having allergy, right? So in all the cases of eczema or allergy, our drug of choice is going to be steroids. So either you go for steroid creams or steroid ointments, and all those things can be done. If it is going to be extensive, like in this patient, you may have to go for an oral steroid as well. And since the patient is also complaining of itching, so because the patient is complaining of itching, what can be prescribed to this patient? So what is that we can prescribe to this patient since he is complaining of itching as well? Yeah, we can give antihistamines as well. So like cetirizine, levocetirizine, loratadine, so all those things. So antihistamines can also be prescribed in this patient. That is how you can essentially manage this patient. Yeah. So now let's see. We have discussed about various common presentations. Now in all these presentations, what you have to do is right now during this learning phase, try to be a good physician who can observe things. Now always take your approach to all these diagnostic hair disorders should be, the first thing is you have to focus on a good history taking. Okay, you have to take a very good history, like when did this lesion start appearing, how was the onset, okay, and what is the duration, is it present for how long, is it 1 month, 1 week, few days, all those things. Especially you have to take some family history, because some things like androgenic alopecia, because you know this baldness and all, it runs in families, right? So there is some genetic reasons also associated. And also you have to ask them, are they taking some tablets? Maybe there is a patient who is having hypothyroidism, the patient is having some diabetes, maybe having some kind of a endocrine disorders. So there are diseases which may be associated with endocrine disorders or systemic diseases. So take a very good history. Now, after taking a very good history, please make sure that you do a proper physical examination. You do a proper physical examination, because when you do a proper physical examination, probably you can find that there is some pitting over the nails. Then that will give you more assurity that you're dealing with alopecia areata. Probably you will see some other features of, erythematous plaques over the extensor surface. Then that will give you more confidence that this is going to be scalp psoriasis. So like that, when you take a proper physical examination, you'll be able to understand what are you, what is the diagnosis that you're going to reach out to. And then after taking a proper history and doing a proper physical examination, make sure that you make use of proper investigations as well. Proper investigations as well. Because in some cases of Tenia Capitus, you can go for a Woodslam examination, correct? So you can go for, what are the investigations that we can actually use? One is Woodslam examination, because you may get some greenish or yellowish kind of a fluorescence when it comes to Tenia Capitus. So we will also go for a potassium hydroxide test, because to confirm a Tenia Capitus, we'll go for KOH mount, potassium hydroxide mount. So also we may go for culture, fungal culture, and all those things has to be done. And in some cases, let us say you are having a patient of scalp psoriasis, you would like to do a biopsy as well. So you can also go for a skin biopsy. So all these are the various investigations that you can actually do whenever you are investigating. And obviously not just that, you will also would like to go for a complete blood count. So you can also go for a hormone profile. Reason? So complete blood count, because you will be able to understand the patient is anemic or not, because in those cases telogen effluvium comes to your mind. Whereas when you go for a hormone profile, like when you do a thyroid function test and all, so you can also try to correlate whether this hair fall is associated with hypothyroidism or any other factors. So that is how you can go for all these kind of investigations when you are going to deal with a patient who is complaining of hair disorders. Now let's see what are the general management principles when it comes to uh, hair disorders. So in general management principle, every time this reassurance is very important. So reassurance is very much important, because any patient who is experiencing a lot of hair fall, so you may think that, okay, let us give importance to only those diseases where the patient is actually in pain, or or is having a lot of sufferings, etc. But when it comes to hair disorders, this is psychologically creating a lot of stress on the patient, because this is something what is exposed to everyone, right? So when he's finding that there is an excessive hair loss and all those things, the patient definitely is wanting to have some reassurance from your side. And more than reassurance, what you can go for is some non-pharmacological measures. Like, you can ask the patient to avoid any kind of a trigger, avoid using a lot of chemical stuffs and all those things. You can address the expectations, you can always address the cosmetic impact. All those things can be done. And finally, the most important thing is pharmacological therapy. So pharmacological therapy, it depends upon the treatment. I mean, it depends upon the diagnosis. For example, in androgenic alopecia, so what are the treatment modalities that we have for androgenic alopecia? Can you at least name some of the drugs that can be used for male or female pattern baldness or hair loss? Anybody? Yeah, very good. 5-alpha reductase inhibitors, and we can also go for minoxidil, isn't it? All those things can be used. Whereas, what about the next one? Telogen effluvium, I told you, it's just like management of the stress and the underlying condition. And alopecia areata, we've already discussed. We can go for steroids. So if it is going to be any allergic contact dermatitis, again we can go for steroids, isn't it? So any other disease that we have discussed? Yeah. So there is scarring alopecia, as in lichen planus, etc., where you can go for some treatment like hydroxychloroquine. So which other disease would you like to know the treatment of? Yeah, finasteride can also be used, Nana. Like finasteride is going to be used in the case of this one. Okay. Androgenic alopecia, that too in males only. Okay, that too in males only. So all these are going to be the various treatments. So treatment, it fairly depends upon what is the final diagnosis, and accordingly the final treatment can be taken up. Clear? So that is all about the common hair disorders. So we have not made this very complicated because I just wanted to keep it very simple, that you are going to see patients in a dermatology OPD, and if a patient is complaining of any hair related issues, at least you should be able to narrow down your differential diagnosis based on these few diseases in mind, and accordingly you will have to send the patient for various investigations and finally reach out to a proper diagnosis and then give a proper treatment. Okay, so is there any questions that you have from this topic, from hair disorders? So if there is any queries, I'll be happy to answer you. I'll just wait for a couple of minutes if there is any queries, because this is one topic, the hair disorders, which is going to have a lot of common doubts, isn't it? More than doubts based on your textbooks or other things. Common doubts are very common when it comes to hair disorders. So if there is no much queries, yeah, then that is it. So please make sure that you go through the clinical corner, because this one, what we are doing right now, that is the Meded clinics. This should be actually integrated with your clinical corner. So please go through the app and just try to explore what is given under dermatology in all those clinical corner. So that will give you a good idea, okay, when you go for your ward postings, when you go to the OPD, what are the kind of things that you need to ask the patient and how you can deal all those things. Clear? So I hope this was an informative session to all of you. So thank you so much all for being a very interactive crowd today, and I will see you very soon with more such topics. Yeah, thank you so much.